Hello, so I'm Sakina Raza. I'm doing a PowerPoint on sexually transmitted infection (STI). So I want to start off first telling you guys about common STIs. There's so many, but I specifically picked these three just because I know these ones are so common and we hear about them so much. And these are always in our everyday life. We hear about them. So the first one is chlamydia. The second one is gonorrhea. And the third one, and that's one of my main topic, if I had a slide only discussing with the third one, I would probably discuss that one. Human papilloma virus, and this is one of the major one I would say I can discuss. So I just want to start off telling about what is really STI. What is it, and I will discuss in further slides about these three, but I really want you to know what is really it is. So it is an infection transmitted through sexual conduct because of bacteria, viruses, and parasites. So I want to start off talking about chlamydia. So this one is a common sexually transmitted infection. This may not cause any symptoms, just to let you know, it might not have no symptoms, but those affected people of all ages. It can affect to all of the different ages, but is mostly common in young people. If you look at any young people, it will be more common than in young people than compared to old people. So as I told this one do not develop any symptoms, but they can still infect others through sexual conduct. And symptoms may include, there could be some kind of symptoms, I would say. I would say probably like, painful urine, but mostly there are no symptoms. And to treat this, you can probably treat it with antibiotics. That will probably stop, growing it, or it might kill bacteria. There are a bunch of the medications. There were many more, but I only chose 5. The one I felt like they're really good ones. Levofloxacin. This one. There is the other one that is tetracycline. The third one is ciprofloxacin. If I can't pronounce those right, I'm sorry, but I'm trying my best. And the fourth one is erythromycin. The fifth one is taxocycline. So those are the 5 major I would most likely say. So now let's move to the next one. So I want to start off talking about gonorrhea. Gonorrhea, can be screened regularly and can help detect instance when an infection is present despite having no symptoms. It usually doesn't have symptoms, but some people have said they might experience certain things like including painful urination and abnormal discharge from vagina or penis. Many men may experience testicular pain, and women may experience pain in the lower belly, and in their vagina as well. In some cases, in some cases those are symptoms, but mostly it doesn't have symptoms. It could be treated as well through antibiotics. There are certain ones, and these antibiotics will stop the growth, or might be it helps to kill the bacteria. There are some similar to the last ones we discussed. is cefixime, it's doxycycline, um, as azithromycin, az- azithromycin, I think, if I pronounce it right, but those are the antibiotics people can take. Of course, through the prescription, they need to, of course, consult the doctor, and most likely the doctor is going to recommend them these antibiotics to help them to, recover, kill the bacteria, and first, of course, they will want to stop the growth first thing, and then further down, they will help to kill the bacteria as well. So let's talk about the human papillomavirus. This is one of the major ones. So I even have 2 slides about them because these are really, really major one, I would say, because I heard, I was reading through, and about 300,000 people die every year. Sorry, not 300,000. I mean 3,000 people die because of this virus. Plus, every year about 300,000 people get diagnostics. They get diagnosed with HPV virus, and this is really one of the common one as well. And it's very easy to get. I would say most likely at this time, I was reading it almost about 78 or about 88. I'm not sure, but one of the other, there are people who are positive, have tested positive for HPV. Usually, it really doesn't have no symptoms. They don't develop any symptoms, but can still affect, if you have sex with some other person, it can, of course, be transmitted to them. They can have it as well. So this one is really, it keeps going on. So it doesn't stop at a point. And I heard a lot of stories in my real life as well. People breaking up HPV because one of the partners will go out and have sex and will come back and have with their, wife or their real partner, they are with, and that person will get positive for HPV. And then, once they find out they have HPV, and they will, of course, realize it's most likely because of him. He might have been cheating or something. So there's lots of issues with this thing. But just to let you guys know, this test to prevent from the further things, because this doesn't really have cure. It does have treatment to to control it, but it doesn't have a cure. Once this virus is in, it is in. Most likely it will go to sleep. They will put it to sleep. Most people use the term that they will put to sleep through the treatments, or make sure it doesn't get to cervical cancer. But there is not a big treatment for this virus that they can clear it out from the body. But honestly, at this time, what I want to let you guys know, the first thing, to make sure you're up to date. People usually say you should get once a year. I also agree, if you have tested negative, you should try after every 3 years if you're younger than 30, less than 30. And you can test this through pap smear, the pap smear test. You can get it done from your, physician or your gynecologist and those kind of people. Let's go ahead towards the treatments. Let's discuss about the treatments. There are three kind of treatments, so we're going to go one by one. So first I'm going to discuss about medical procedure. Medical procedure that has loop electrosurgical. This is using a wire loop heated by electric current to remove abnormal cells and tissues from the cervix and vagina. So there are a little as you can, and further you will see in the picture in my next slide. They get little warts around the vagina or inside the cervix, so they will try to remove them. The second thing is freezing, using extreme cold during surgery or medical treatment. So they will use something cool, something freezing, and I think it's like something freezing material to freeze them so they don't start growing. Then there's a cervical concision. It's a surgical removal of a cone-shaped tissue sample from the cervix, also known as cone biopsy. So these all things are in medical procedure. If you get those, most likely you will be able to control on that virus. Let's do next. So as I was talking on the other slide, you can see those little warts on the picture. Those are the warts people will get around their vagina or inside the cervix. So the other one is a medical way, like a medication. I think you can take it. So this is a topical anti-tumor medication. Treats skin cancer and other skin conditions. It helps you, for those kind of things. And then the third one is surgery. You can get a surgery. That is electrosurgery, using electrical current to cut the tissue and control the bleeding during surgery. So those are the ways to, prevent from it to get from warts, from virus to cervical cancer. That's what's very important for us to get it tested. It's nothing big to get shame of HPV. It's just you need to make sure you're keeping up to date. You're preventing from it to get to a cancer, and it's not safe to. And of course, to get cancer, you can. There's so many things. People die of cancer, so that's very important to keep a look on. So now we're going to discuss. So this is the figure for chlamydia. These are the numbers from 2018. I was trying to find the latest, I think because of COVID-19. They're not making for 2019. But I was just checking it out too. That's just a joke. But as you see, if from age 10 to 14 for male, it is really kind of high, I would say it's high. It is about 13.6 thousand already. And for females, we see it's 92.9. With the time, the most age, if you can see, is from 15 to 24. And they're high, and female rates are high, about 3306.8 and 4064.4. And remember, it's 100,000 per unit, so they're a lot. And as you see, females get really high numbers. Females are really high to get with chlamydia. So it's just when you start getting old, it starts decreasing age by age. So by the way, just to let you know, these are only for United States. It's not worldwide or something. So those are kind of high number in 2018. So now let's go and look into gonorrhea. So gonorrhea reported cases in 2018. Males were very less, it's 4.8, but females were 21.3. And it's funny, I see, like in the last, females were more, but I see males being high on gonorrhea. So I see from 15 till they are about 35. It's kind of very high. It's kind of really high in men. For females, from 15 till they are about 29, 30 years old. It is kind of high, but still, males are highly risk. But as I see one more thing, 15 to 19-year-old males usually have less than females in that age group. So it's weird, but I mean, it's more likely, I think, in that age, female can get, infected by it more than a man. So that could be one of the reasons. Now let's discuss about HPV, my favorite one to discuss about. So for the HPV, we see huge numbers. So just to let you know, this is also from 2019. The most people are getting, so the green line is showing for positive HPV, the line that's going on. Majority, a big breakdown starts after they they get into 30s, their 30s. It keep going higher and higher and higher. And I was just checking it out as well. When you get older than 30, as I told you, you get a higher chance. So that's why I told you to get checked every year. But when you're less than 25, you can still get, most people get, because it's a young age and people like to go out and try to be with different people. This can still have a high risk to get HPV, and there are so many people, they are tested positive to HPV, but there are a big higher number when you turn over 35 or over 30. I would say most likely over 25 to they are way older. That is the age for the most HPV to be tested positive. And as I already told you, the treatments and ways to prevent. But what sucks about HPV is there's no cure towards it. And at this, that is all for me to say about it. I'm sorry about the pronunciations for some words, but I hope you really enjoy it, and I hope you guys take this presentation serious about your life. You take your life so serious because it's given once. Keep your health up to date. Keep getting these tests. Get yourself tested for these things. So nothing happens bad, and you stay healthy, and enjoy and have fun. Bye. Once again, my name was Sakina. Have a great day. Bye, everyone.